All right, I'm gonna try my best. I want to do a whole series of this because I want everybody to pass nursing school, because it sounds like nursing school is not doing a great job. Cardiovascular, you're going to want to know the flow of blood when it enters into the superior inferior vena cava, into the right atrium, into the right ventricle, into the lungs. You're going to want to know the whole little journey and the parts and the vessels there in the heart. Then you're going to want to know the three layers of the heart: the epicardium, the myocardium, and the endocardium. Epicardium on the outside, myocardium is like the muscle-y part, and the endocardium lines the chambers and the valves. The little Ziploc bag that holds the heart is the pericardium, and it has two little layers, and the space in between those layers is the pericardial space. And when that fills up, that's what puts pressure, and that's what creates like tamponade. Know the little electrical circuits and nodes in the heart: the SA node, which is like the pacemaker, the AV node that kind of like slows or fixes the conduction, and the bundle of His, and the Purkinje fibers. Know the little heart sounds. S1 is the closure of the AV valve. The sound of S2 is the closure of the semilunar valves. Loved up. If you have an S3, that means the ventricle is taking too long to fill. If you have an S4 sound, that means that the atrium is like forcing the contraction, and it's being too forceful. Normal range is 60 to 100. Lower than 60 is bradycardia. Higher than 100 is tachycardia. The sympathetic nervous system increases the heart rate, and the parasympathetic nervous system decreases the heart rate. The vascular system is arteries, veins, and capillaries. Arteries carry the blood away from the heart to the periphery of the body. Veins carry the blood back to the heart, like, hey, we need a refill. And capillaries are the ones like at the very, very end, and they actually connect the veins and the arteries. I feel like I should mention the lymph system if we're talking about like vascular stuff. It collects extra vasculated fluid from the tissues and returns it back into the blood. Regarding hematology, you should just know like the major blood disorders: anemia, polycythemia, and leukemia. Anemia depends on what the cause is. Maybe it's nutritional anemia, maybe it's iron deficiency anemia, and that kind of like that pathophysiology determines how you treat it. Anemia, we test the blood, we do a CBC, we test for hematocrit hemoglobin, red blood cells, we also test for serum iron or low ferritin, and then in some cases we test actually the bone marrow. We can tell them to eat iron-rich food. We can give supplements, to always take the iron supplement with vitamin C. You can do a bone marrow transplant. You can do packed red blood cells or RBC transfusion. Polycythemia, it's where stem cells just go nuts. They make your blood thick, and they make your bone marrow like fibrous. You're gonna have high white blood cells and platelets. You're at risk for bleeding, so you're going to actually do some phlebotomy to try to reduce some of those cell masses. You also might get chemotherapy and allopurinol. Leukemia suppresses the bone marrow, and then you have a bunch of immature cells. You need chemotherapy and a bone marrow transplant to treat it.